This is TV 10 and 55 Focus, a program dealing with issues affecting everyone on Long Island and the tri-state area. Now your host, Richard Rose.
Hi, I'm Richard Rose, and welcome to Focus. It is our pleasure today to have as our guest Arthur Gianelli. He is the president and CEO of NuHealth, which is the umbrella organization for the Nassau University Medical Center and its many other health operations, and we'll get to that in a moment. But first, I'd like to introduce my co-host, and you may know him as the former Suffolk County Presiding Officer, Paul Tonna, and as is our custom here, Paul will start us off.
Thank you. So, Art, it's great having you on the show.
It's great to be here. Thank you, Paul.
So tell me, you have a very unusual path. You went from being the Deputy County Executive of Budget in Nassau County to running a very, very large, very big hospital with a lot of challenges. So tell me, how did you go from one very difficult job right into another very, very difficult job?
Well, it's an interesting question, and it is an interesting career choice, I suppose. I worked for nearly 5 years for County Executive Swazi. We did an exceptional amount of work to attempt to recover the finances of Nassau County. 12 credit rating increases over the course of a 3-year period of time, balanced budgets, surpluses, a lot of really good work. But when we concluded County Executive Swazi's first term, I had actually made the choice that I was going to move to the private sector, but I was asked by County Executive Swazi to stay on and to run the NuHealth system, the Nassau Healthcare Corporation, which runs the Nassau University Medical Center, A. Holly Patterson, and a number of community health centers. I originally said, no, you're crazy, this is nuts, I don't have the background to do this. But I felt that I could lend my knowledge of government, my knowledge of the local area, and my strategic understanding of the issues facing NuHealth to try to help in its recovery. And I have to say, from a professional and personal standpoint, it's the best decision I ever made.
How long have you been doing that now?
March 8th, 2006 was my first day at NuHealth.
Now, NuHealth, people got to get used to that name. Is that a name we'll see a lot, or is that just one of those legal names that's in the paperwork somewhere? Is it still going to be the Nassau University Medical Center, or are we going to start seeing NuHealth somewhere?
Well, that's a great question. The NuHealth is actually the corporate name. It's the name of the umbrella organization that runs the Nassau University Medical Center, the A. Holly Patterson Extended Care Facility, and a number of our community health centers that are in Roosevelt and in Hempstead, in Newcastle, and in Elmont. We wanted to provide a brand identification to all of our system facilities, and we felt that we wanted a name that really tried to show what we're trying to accomplish. And we felt NuHealth really did that, because what we want to tell people is it's a new day and we're embarking on a new direction in providing care to everyone in Nassau County, but particularly the most vulnerable people.
You know, I had an opportunity a number of times now to walk through that amazing 22nd century emergency room. And it just seems like there's a completely different attitude. Yeah. It seems like, it's just a completely different feel in the place. So tell us a little about some of the really innovative things that NuHealth is doing right now.
Well, I'll start with the emergency room, Paul. We were very fortunate to receive a grant from the state of New York, and putting together money from the state, money from the county, and some of our own funds, we were able to build really a state-of-the-art facility, 3 times the size of the space that we were in previously, separate areas for walk-in traffic, for ambulance traffic, and for helicopter traffic, because we're still a level 1 trauma center, beautiful large bays, a number of what are called negative pressure rooms, so that if you have to have people isolated, you can do that easily without erecting tents, etc. It's spacious, its flow is terrific, it's easily accessible, convenient, and has a great feel for the patients. We have terrific equipment. We have a 320 slice CT scanner, the most refined CT scanner on Long Island, other than at Stony Brook, with the same equipment as Stony Brook. We do really state-of-the-art work in our emergency department. We've always been known as a level 1 trauma center. Now we're the premier level 1 trauma center in the premier emergency facility on Long Island. We're very, very proud of that. But even beyond that, we've made a lot of investments in our breast health center, in renovating a number of our different floors, building a brand new health center in Roosevelt, installing state-of-the-art health information technology, bringing in the most refined breast imaging equipment anywhere on Long Island. So if you want the most detailed and most refined images in order to promote breast health, you come to the Nassau University Medical Center.
Yeah, and of course you have to deal with not only the demand from consumers, the patients, on what they feel a hospital should offer, but you also have the competition of trying to keep the books balanced and yet provide for the general welfare of the people who come in your doors. Did that all go into the strategy of the approach you took here?
Well, certainly. Our approach, my approach strategically when I first got there is that to the extent that we had funds, we needed to reinvent what we did. We needed to reinvent the way we delivered care, we needed to reinvent the quality of care we provided, and we needed to reinvent the physical surroundings in which we provided that care. We've been able to reinvent those physical surroundings, and actually there's a number of things that we're doing now to really reinvent how we provide care and to elevate the quality of care that we provide.
Yeah, in particular, there was just this past week what got into the news, the decision to drop some hospital beds in order to apply for a state grant, a significant one of $30 million, but also expanding your outpatient primary care. And we have to take a break right now. When we come back, we'll talk with our guest, Art Gianelli, about how that's all going to work in NuHealth. Stay with us.
TV 10 and 55 Focus now continues.
And we're back. I'm Richard Rose here with our guest, Arthur Gianelli, Art Gianelli, to folks who know him, and our co-host, Paul Tonna, the former Suffolk County Presiding Officer. And Mr. Gianelli, you're the President and CEO of NuHealth, the overall umbrella organization for the Nassau University Medical Center, the A. Holly Patterson Center, and 4 health centers and a 5th that you have a stake in. So, you know, your medical organization is familiar to many people on Long Island, if not all, and people throughout the area. So when anything you do there happens, it makes big news. And this past week you made news with a decision by the board to cut back a number of hospital beds, about 50, I believe, out of the 530 that are there, and to cut a number of detox beds, I think 10 out of 20. And what was the reasoning behind that? And, you know, how does that help you improve your outpatient reach?
Sure. Well, you have to take one step back, and we have to understand the dynamics that are occurring in healthcare today. Everybody knows that healthcare costs are exploding and very difficult to control. And policymakers at the federal level, at the state level, are all trying to figure out ways to bring our costs under control but still provide really good quality care. And to do that, there's been a number of efforts to really change the paradigm through which we deliver care, to move away from an inpatient-based model where the emphasis is on moving people into a hospital, filling hospital beds, because that's a very costly approach to providing care, and it doesn't necessarily lead to the best outcomes. And instead, try to figure out how to provide the best possible care in the least expensive locations. And if you compare lower cost and higher quality, the hope is we can transform the system by improving it. So the state of New York, at the end of November, issued what's called a request for applications and said to all of the hospitals and all of the nursing homes across the state of New York, they said, look, we're going to be willing to give you capital dollars to make physical plant improvements. We're going to be willing to give you transitional rate enhancements in your Medicaid hospital rates and outpatient rates. And we can even give you some protection to allow you to, antitrust protection to allow you to collaborate with other partners in healthcare if you restructure your operations, reduce your inpatient capacity, build your outpatient capacity. And that's exactly what we did in our proposal that we submitted back to the state. As you indicated, we're proposing to downsize 50 beds, but we're proposing concomitantly to dramatically increase our primary care capacity. To build on our first floor right next to our emergency department and right next to a pharmacy that's going to be run by Walgreens, a major primary care center with significant care management resources, and in our ground floor provide co-located detoxification and alcohol outpatient services as well as primary care services. It will be state-of-the-art. We will be emphasizing care management, and we will be emphasizing all sorts of strategies to keep people healthy and out of a hospital as opposed to in a hospital unnecessarily.
Does this help you deal with the prescription painkiller abuse problem in any way? I mean, that's been exploding by every source.
I think it absolutely does. The evidence is that just simply admitting patients into a bed for detox or chemical dependency, the evidence shows that that doesn't do any better than outpatient services. We're going to be able to see 5 times the number of patients in this model than we can today. Right. So we think we're going to have a much greater impact on what's going on Long Island than how we're currently approaching things.
You know, one of the things that I notice, and having known you for quite some time, is your passion for healthcare, your passion for people, your passion for the underserved. And I think that's part of your story and part of the story of NuHealth. So tell me a little about the team that you have, the passion that you guys have, because I see a hospital with a real sense of mission.
Sure.
So what is it like to work with the people that you work with the passion that you have?
Well, our mission is to provide the highest quality, lowest cost care to the most vulnerable residents in Nassau County, and that's a mission that we believe in wholeheartedly, and we have a wonderful team of professionals assembled to do that. My Chief Medical Officer is Dr. Steve Wallerstein, who I've always characterized as a perfect Chief Medical Officer for a safety net facility such as ours. We have an array of very well-credentialed and in many instances internationally known chairs of our various departments. Dr. Alan Maltz, for example, is chair of medicine. Dr. Tony Booten is chair of the emergency department, just to name 2. We have an exceptional array of primary care physicians, an exceptional array of specialists. Our chair of cardiology is Dr. Sanjay Dodamani, for example. He comes directly from North Shore LIJ, and is in cardiology is actually one of the truest examples of the kind of collaboration that we are seeking to have across all of our departments with North Shore LIJ. In this particular instance, North Shore LIJ has put some of its best doctors in our hospital to provide top-line cardiac care. So when you come to the Nassau University Medical Center, you are getting North Shore quality care right in East Meadow in the Nassau University Medical Center.
Yeah, we want to talk a little bit about the North Shore LIJ collaboration and what that means for the direction of the hospital. But how large is the staff at your organization, NuHealth, including the hospital? And how does this reorganization affect the number of jobs that there are? Will there be less jobs, more jobs?
We have about 3,800 full-time equivalent employees at all of our facilities, and actually this model is going to increase the number of staff.
How's that going to happen?
The reason it's going to increase the number of staff is that we're going to hire over 70 care transition coordinators. These are people that will go to people's homes, go to patients' houses, and will work with them on medicine reconciliation, make sure that they have an appointment with a primary care provider, try to arrange their transportation issues if they don't have the necessary transportation to get to their provider. The whole key is to do all of the things necessary to keep people healthy and in their homes and not in a hospital. That's better care for them, it's higher quality care, and it's less costly for the system.
Well, it would seem to me that one of the huge advantages when you have a county who, I guess it was in around, 2001, it stopped being, totally and solely responsible for NuHealth or Nassau University Medical Center. It would seem with all of the troubles that they're having right now and just meeting budgets and dealing with all the things, I would think that the elected officials and everybody else there are so happy to have somebody of your quality, holding down the fort and actually expanding and really increasing the service at NuHealth.
Well, I'm not going to say that every elected official is always pleased with everything that we do at NuHealth, but I will say that I think over the years I've managed to earn and cultivate the respect on both sides of the aisle, and I in turn have respect for the elected leadership at Nassau County. Nassau County is a very, very challenging government to run, be it being run by a Democrat or a Republican. Having worked at Nassau County, I know that firsthand, and I know the kinds of efforts that are being undertaken even today to really try to turn things around. I think in turn they know that I'm working very, very hard day in and day out to make sure that we're a financially stable institution that's providing the highest quality care to Nassau's most challenging and most vulnerable residents.
Well, let's talk about that. How financially stable is the organization now? Because as Paul mentioned, a decade ago it was in big trouble.
Right. We actually, last year wasn't such a good year, but I'll preface it by saying first that the prior 2 years we actually ran in the black very slightly for the first time probably ever. And the A. Holly Patterson Extended Care Facility, our nursing home, which had chronically lost money, made money for 4 successive years. Last year wasn't so good. We lost some money last year. And the reason for that was a combination of 2 things. One, significant cuts in Medicaid reimbursement that have occurred really in the wake of the financial crisis. And 2, because of the stock market decline, our pension costs, because our employees are in the New York State Employee Retirement Fund, our pension costs have exploded. In 2009, we paid $17 million to the New York State Employee Retirement Fund. In 2012, we will pay $42 million. These are extraordinary numbers.
An extra $25 million.
An extra $25 million.
Totally out of your control.
Yeah. Yeah.
So would you favor more instant pension reform? I mean, many of the proposals, even the latest put forward by the governor, actually apply to future hires and don't really attack the payouts that are going now. Do you think that the reform should include people who are receiving pensions now?
I think to the extent that it could, I would agree. There are constitutional issues that would have to be dealt with, but as I have indicated to the governor's office, I've indicated to our elected representatives in the Senate and the Assembly, it's simply unreasonable to expect a hospital which cannot raise taxes and cannot raise user fees, and it is dependent upon Medicaid and Medicare and therefore can't negotiate those payments, to somehow accommodate a $25 million increase over 3 years, on an annual basis, over 3 years in its pension costs.
Yeah, I think people struggle with the idea that hospitals lose money because they see that, premiums go up every year and health care goes up every year 10 to 20%. The medical industry is considered to be lucrative, has some of the highest paying jobs. Many physicians make good money, many people in the industry make good money. And then when you hear that hospitals lose money, it just sounds confounding. How does that happen?
Well, in New York, hospital margins are very, very, very tenuous, even for some of the best systems, even for the New York Presbyterians or the North Shore LIJ systems. There was just a report recently done about hospitals in Brooklyn, and it identified 6 hospitals in Brooklyn that are essentially financially failing. Okay? And that's because in New York, you have a lot of hospitals, you have a lot of fixed cost, you have very high cost of delivering health care, and you have high penetration of Medicaid and self-pay patients. And as we know, Medicaid does not reimburse your full cost of care, and of course, self-pay patients don't pay the full cost of care either. And that cycle is what's really dragging down a lot of hospitals. It's one of the reasons why the state of New York issued this request for applications, because the state's view is, look, we have to change the configuration of healthcare in New York because there's not enough money to support all of these institutions. It's not sustainable. So we need to consolidate, we need to get organizations to integrate and work together, and we need to create more primary care capacity because outpatient primary care capacity is less costly than hospital care.
And that's part of the idea behind the collaboration with North Shore LIJ, which we'll take up when we return with our guest, Art Gianelli. Stay with us.
TV 10 and 55 Focus continues.
And welcome back. We're here with our guest, Art Gianelli, and my co-host, Paul Tonna. And Mr. Gianelli, tell us more about this North Shore LIJ collaboration. North Shore LIJ, of course, one of the largest organizations, medical organizations in the country, right?
That's right. 43,000 employees. I think it's 15 hospitals. It's a major, major system, not just in the region, but frankly in the country.
So you wouldn't be getting absorbed by them, right?
No.
This would be a partnership. But what do you envision 10 years from now is going to be the relationship?
Well, it's hard to say, but the longest journey starts with the first steps, right? And in this particular case, my view is let's take that first step together. And the first step is really building on a very general affiliation that we entered into in 2005. This step is to move a step further. What we propose to the state in our response to the request for applications is to create a limited liability company. We're going to call it the Transformation Partnership. And so North Shore and NuHealth will own that LLC equally, and that LLC will oversee all of these efforts to transform our institution from inpatient to outpatient care and to change the delivery model. But it's also going to oversee how we integrate with North Shore LIJ. And one of the key goals is to clinically integrate each and every one of our service lines so that, and I like to characterize it as having departments without walls, so that when somebody comes to our hospital, they will know that they are getting North Shore quality care at every level of service within our organization.
So it's building synergies right, which has to be able to reduce costs in the long run and improve quality.
Well, it's certainly going to improve quality, and to the extent that we're more efficient, it should ultimately reduce costs. And those are the two big goals of what's called a clinical integration strategy. And in the process of doing that, our hope is that we're going to be able to take advantage of protection that the state will give us to allow us as two separate autonomous entities to collaborate strategically, to collaborate in quality, and to collaborate in such a way where North Shore can help us in our negotiations with managed care companies. Because if we are paid appropriately by the managed care companies, and I just say appropriately, not large, appropriately, I believe we can be a financially stable institution in the long term.
It's great.
And you gotta wonder though, in the situation we're in right now with the political debate over health care reform and whatever mandate you're under right now under the current administration and what the Republicans who'd like to take over in Washington would prefer to do, how confusing is that to deal with? Has that affected you in any practical way right now as far as trying to establish a future policy and how to handle the finances of your organization?
No, that's a very good question, and the answer is really no, and let me explain why. The Affordable Care Act, which is obviously a controversial bill that was passed by the federal government, it has two pieces. It has the insurance piece, and it has what I would call the innovation piece, the delivery system reform piece. The insurance piece is the piece that everybody gets in a lot of political debates about. You know, is the individual mandate constitutional? We're going to find that out, right?
The Supreme Court will take that up.
The Supreme Court's going to take that up, and they're going to let us know. But the pieces that no one's really debating are the changes in how we pay providers to deliver care, from a volume-based approach where you get paid every time you do something, to a value-based approach, which says providers, we want to pay you for quality, and we want to pay you to actually reduce unnecessary utilization. Right. That paradigm shift is huge. It's happening. The train has left the station, and it is occurring all across the United States. And that is not going to be reversed. So my view is that regardless of what happens to the insurance piece, the innovation piece sticks, and we have to either get ahead of that curve or we're going to be left behind.
So Art, just quickly, with all of this stuff being so complicated, with all the challenges, I know that you always are trying to integrate home and work. So tell me a little about your wife, who I think is a district court judge.
Yes, she is.
And you have a 16-year-old teenage daughter. So that in itself, I think that's probably the toughest negotiations that you probably have.
Well,
so.
Yeah, no, thanks, Paul. I'm happily married to Sharon Gianelli. She's a judge. She's been a district court judge, I think, since 2005. She was just reelected. I have two children. Jessica is my teenage daughter. She's a junior at Herrick's High School. My son is Cameron. He's 20. He is enrolled at Nassau Community College, and I have a dog named Casey.
You got it covered.
You got it covered.
And you're married to a judge. So.
I'm married to a judge. So
does that prevail?
My authority ends at the
I can see those debates. I can see those debates at the kitchen table
That's right.
or the dinner table.
That's exactly right.
That's great.
But
So,
yes.
I'm sorry.
But for now, this is what you're going to be doing for the next several years, right? I mean, you're not thinking about some other horizons. I mean, you've had a number of careers. This is where you're going to stick?
Well, I mean, I'm putting all my effort, 110%, into really affecting this transformation. This was a critical vote that our board of directors took this week. I want to congratulate them. It's a gutsy vote. Not every board of directors would willingly surrender inpatient beds and move forward into the future that way. They took a good vote, and I think it's the right move, and we're going to make a huge difference. And
we only got about 30 seconds left. How do you feel the public will receive it?
I think once people know what we're doing, I think most people think what we're doing makes a great deal of sense. I spent some time with my staff today. We do something called the Nassau Learning Academy, and I talked all about this. And many of them came up to me afterward and said exactly that. You said, you know, we didn't know all of the facts. Now that we know all of the facts, we think what you're doing makes a great deal of sense. It's terrific.
Well, we want to thank you for coming and explaining it to us.
Great, Art.
Thank you.
Fantastic.
Thank you.
Thank you for being our guest today. Arthur Gianelli, President and CEO of NuHealth, the umbrella organization for the Nassau University Medical Center. Of course, my co-host, Paul Tonna, thank you very much, former Suffolk Presiding Officer. And thank you for being there. I'm Richard Rose. Be sure to join us next week for yet another edition of Focus.